Now, for the sake of the beginners, we'll look at a question that it will look funny to you after you have advanced in medicine. And this is trying to state the reason or state a connection to how renal artery narrowing or blockage can cause hypertension. So there's a narrowing in this renal artery. That's the artery that is actually what taking blood to the kidneys. Can this cause hypertension? The answer is yes. Why? Because blood is supposed to reach the kidneys so that fluid is filtered out, waste is filtered out. If there's a narrowing, there's less blood reaching the kidney. So that means what? There's a backlog of blood, including the fluid in it, including the waste products in it in the body. So there's expansion of the body fluid stores. This could increase the blood pressure and cause hypertension. But let's talk about this in depth. So just so you know, um, reduced narrowing of the renal arteries, there's backlog of fluid and also waste, but it also causes activation of the renin angiotensin aldosterone system. This system causes a production of a substance known as what? Angiotensin II. Angiotensin II usually what? Increases the narrowing again, vasoconstriction. So this worsens the issue. So reduced renal perfusion is when the artery is narrowed. It could be atherosclerosis or it could be a muscle issue like fibromuscular dysplasia. So the kidney is not receiving a lot of blood. So there's backlog of blood in the body, first of all. And secondly, the kidney is trying to act against the low blood reaching it. So it's trying to activate the renin angiotensin aldosterone system. So it releases renin. So the juxtaglomerular cells will secrete renin. Angiotensin II will be activated. So Renin will become angiotensin 1. Angiotensin 2 will be converted by angiotensin-converting enzyme to become angiotensin 2. Okay? Then aldosterone secretion. So angiotensin 2 will stimulate aldosterone release, causing a lot of sodium and water to be retained back in the body. So you can see how this condition complicates itself by itself. So clinical features is what? You have hypertension that is resistant, you are treating, but it's not going. Then the hypertension, of course, is sudden, abdominal breath, there's a whooshing sound over the renal arteries. Kidney function is just declining. And creatinine, which is a waste product, the levels are going high because it's not being excreted out of the body. Then you also have the flash pulmonary edema. Okay, so this is what we have, renal stenosis. It could be due to fat deposition, that's atherosclerosis. It could also be due to fibromuscular dysplasia. So causes, it could be atherosclerosis, it could be fibromuscular dysplasia, just like I told you guys. You diagnose it using ultrasound, CT angiography, MR angiography to visualize the narrowing, okay, and also captopril renography or renal vein renin measurements. So management include all those angiotensin converting enzyme inhibitors, also the angiotensin receptor blockers, calcium channel blockers, also diuretics, then also revascularization therapy, where you basically try to do angioplasty. We are trying to like cut off what is narrowing the blood vessel or put a stent, something that will permanently just keep the blood vessel widely open.